October is National Depression Education and Awareness Month. It is one of the most common mental disorders affecting 1 in 20 people worldwide. It is in the last few years, more Americans say they've experienced depression, but many never seek out medical attention. So joining us live this morning to discuss is Dr. Ricardo Whyte. He's a psychiatrist with Dignity Health Community Hospital in San Bernardino. Really appreciate you being with us. Thank you.
Good morning, Irene. Thank you for having me.
Well, let's start off with depression, the symptoms of it, and how this can really impact your life. I know there are some symptoms that people aren't necessarily aware are symptoms of depression.
Well, the big thing to pay attention to is disorder, meaning an impaired ability to function, and also noting the change that occurs in your ability to function. So there are things you should be paying attention to, like thoughts of death and dying, feelings that you just don't belong, problems with sleep. There's studies documenting that patients with depression, 90% of them can be having symptoms of insomnia, problem sleeping, change in appetite. But the big thing is noticing a change from your baseline. These are things that should alert you to get help.
Lifestyle. And we've been dealing with a lot in the past few years. Can you explain what's behind the recent rise in people reporting depression?
Well, it's interesting because the World Health Organization documented a 30% increase in depression and anxiety over the year of the COVID pandemic. And what's interesting is noting that COVID-related stressors plus low income, as well as having less than, for example, $5,000 in savings, or even not being married. These are some of the factors that actually increase the likelihood of people experiencing symptoms of depression connected to the pandemic.
Yeah, a lot of problems that have really stemmed up from the pandemic affecting us mentally. Can you explain the difference between having a depressive episode and being diagnosed specifically with depression?
No problem. So first and foremost, to make that diagnosis of depression, you of course have to rule out medical conditions. But depressive episode, you have to meet criteria that's outlined in the DSM-5 in terms of, of course, I could go through the symptoms, whether it's anhedonia, low mood, problems with sleep, change in appetite. But first, you meet criteria for that depressive episode, and that is a prerequisite for you to be diagnosed subsequently with a major depressive disorder.
So it's really all about talking to a psychiatrist or a psychologist to make sure that you're getting the accurate diagnosis on what's happening with you mentally.
Irene, it's so critical to put together your mental health team before you need it. Especially practitioners that are skilled, a lot of times their practices are closed, so that heaven forbid you start looking for help when you're in the midst of that crisis. Your goal, your intention is put together that team before the crisis. Make sure that you have stability and that you have a plan, so that when things happen, you're not waiting for the crisis, but you're prepared. And you have that relationship with a team of practitioners that are going to make your case a priority.
Very key, establishing that plan ahead of time. Now, what are some factors that put someone at risk of developing depression? I know you mentioned a few of them dealing with the pandemic and the problems that have arisen in the past few years.
Well, there can be genetic factors. So if the mood disorder is common in other members of the family, that can be something that can increase the risk. There can be stressors that a person may go through that might increase their risk of depression. There are actually nutritional factors as well, and even things like traumatic brain injuries. So there can be a host of things that can increase a person's likelihood of coming down with depression. The key is paying attention to some of the lifestyle factors, making sure you're getting good sleep, good nutrition, making good choices, the kind of choices that multiply your options rather than restricting your options. These are things that can reduce your likelihood of succumbing to depression. And then, as we mentioned before, being preemptive and making sure you have that team in place to help you recover and understand what behaviors you need to engage in to avoid coming down with depression in the first place.
Now, let's say you're trying to assess yourself. Something's wrong. You can sense that there's something off about your lifestyle. Maybe you're not getting enough sleep. How do you recognize depression in yourself or also maybe in a loved one?
Well, the key is change in function. So people will be behaving a certain way at baseline, and then now you notice a change. They're not engaging in activities that they normally enjoy. They're not wanting to participate maybe in social events. They're not maybe wanting to attend to their activities of daily living, bathing, getting dressed, or what have you. When you notice that change, that's when it's time to escalate things. And especially if they're starting to talk about thoughts of death and dying, that should have you, hey, sound the alarm, whether for yourself or for others, whether it's engaging additional family, whether it's reaching out to hotlines like the suicide hotline or engaging emergency or county resources. Sometimes we make the mistake of underestimating the high quality individuals that can at times staff counting agencies that can be incredibly helpful in these kind of situations. So the goal is to recognize that those changes, and then activate help.
Yeah, keeping a close eye on a person's motivation and those thoughts and those expressions of possible death. So what suggestions do you have for someone who is experiencing depression or maybe just trying to help someone who is going through this?
Well, I think it's very critical to make sure that you are engaging in some of the things that are available to all of us, making sure that life is nice and balanced, getting the sun, getting the nutrition that you need, um, getting that checkup as regularly as possible. When things are going well, it can be so easy to neglect getting into the doctors and of course making them aware of some of the things that are going on. So making sure that you're actually writing things down so that when you meet with that doctor, your mind doesn't go blank and you forget everything. So preemption is a big deal going into the holidays, of course, and with stress, sometimes there's increased substance use. And it can be a really helpful thing to avoid substances and especially abusing substances. These are some of the ways that you can preempt increasing your risk for depression.
You also mentioned there the holidays are coming up. It's getting cooler. We're not going to be seeing as much sunshine. So what suggestions do you have for people who experience seasonal depression or depression around the holidays where they really feel their emotions ramp up?
Look, I remember it was so helpful for my wife and I after having a very stressful holiday to sit down and say, what are going to be our standards? What are we going to do to what boundaries will we put in place to make sure that we're happy with our experience during the holidays? And it's made all the difference. So it's about sitting down, identifying for yourself, hey, what's important to me? What is the experience I want to have? Because the expectations during the holidays can be sky high. And there are studies documenting the fact that there are people who, if they have a pre-existing mood disorder, about 60% of them can have a sense that things get worse during the holidays. So it's about monitoring for yourself and saying, hey, what are the expectations? What's the experience I want to have? And how do I make sure that I set the boundaries that are important so that I don't drive myself crazy this holiday season or magnify what mental illness I may be experiencing?
Yeah,
And of
sometimes.
course, sometimes the therapist can play an important role in setting those boundaries. Over to you, Irene.
Very, very key. I know sometimes we romanticize the holiday season, and when it doesn't live up to our expectations, we fall into those depressive spirals. So thank you so much for your insight this morning, Dr. Whyte. Really appreciate it. Thanks for being with us.
Thank you for having me, Irene. All the best.